I'm going to show you how to drop your blood pressure within minutes, and it's absolutely free. In fact, I'm going to show you 2 different methods. Here's how you do it. You're going to breathe in through your nose for 4 seconds, so you'll need some type of timer. And here's the key. You're going to breathe out through the nose for 6 seconds. Breathe in 4 seconds, breathe out very slowly for 6 seconds, back and forth for a few minutes. Now, it'd be great if you have a blood pressure cuff to measure this before and after, because it's going to come down. It'll come down anywhere between 3 to 5 points, okay? But first, let me tell you why this breathing technique works for blood pressure. It has a lot to do with a nerve called the vagus nerve. This is the longest nerve in the body. It runs from your brainstem through the entire heart and all the different organs. And you can actually control the vagus nerve through your breath, specifically through exhalation. So the vagus nerve fires hardest when you exhale. If you ever notice someone during a panic attack or when they're stressed out, how they're breathing, their exhalation is very short, and so there's no brake pad. And so you can also use this breathing technique anytime you're stressed, and especially in a panic attack. Okay, the second technique is very, very simple. It's also free. All you have to do is go outside in the sun and expose your skin to the sun for 10 minutes. Because the sunlight, when it hits your skin, releases something called nitric oxide. That is stored in your skin, and that's what widens your blood vessels. It creates a vasodilation effect, and it nudges your blood pressure down a little bit. But there's a much bigger question that we need to answer that relates to what is really causing hypertension. And by the time you get diagnosed, it's very, very late on the chain of events. What's pretty wild about high blood pressure is the way they diagnose it. Before 2017, stage 1 hypertension started at 140/90. Today it starts at 130/80. Overnight, in 2017, 4 million additional people were put on medication for high blood pressure. Now, of course, the danger of hypertension is that you're at risk for a stroke, a heart attack, and other problems. Once you're diagnosed, you're put on medication for the rest of your life. The conversation that's not happening is what's causing my hypertension and what can I do to correct it? And then what actually triggers it in the first place? Now, if we actually take one step before hypertension, the arteries are becoming stiff. Now, what would have been a great test to do earlier is called the pulse wave velocity test, and that measures how stiff your arteries are. And I think it's really smart to do a screening test that will predict high blood pressure well before it occurs. So as we come this way backwards, we're coming into the pre-hypertension states and then the pre-hypertension states. And some people look at a pre-hypertension state as, I don't have high blood pressure yet, so I'm good, so I'll just wait on that. No, that's not how it works. It just tells you where you are on the chain of events and where you're going. You don't want to necessarily just ignore it. You want to do something about it. So that's just a little clue that you might want to investigate this a little bit deeper. But unfortunately, our healthcare system doesn't do that. You're put on a medication to manipulate your blood pressure, to lower it, without really going into the root cause. 90% of hypertension is called essential. What does that mean? It means we don't know what caused it. Unknown cause. Probably because out of all the research that's done in healthcare, only 1.9% of it is done with lifestyle factors. The great majority is with pharmaceutical drugs. So a lot of the research is to find what drug lowers your blood pressure versus how do we actually find the root cause of the blood pressure? You can't patent that. And the big thing you need to realize is when you're lowering the blood pressure, you're not actually fixing the stiffening of the arteries. So what comes before the stiffness? Usually it's high levels of insulin. And insulin is a hormone that helps regulate blood sugar. It's rarely ever tested, but there's a lot of data to show that when you increase insulin, like a chronic elevation of insulin, it causes hardening of the arteries. Also, when you elevate insulin, you retain sodium. Interesting. If you retain sodium, you retain fluid, you'll have more volume of fluid in the body. That's why one of the most popular high blood pressure medications is a diuretic to actually flush out the water, assuming that it's there because there's too much sodium. I would highly recommend, if someone told you to reduce your sodium, what about the option of raising your potassium to handle the ratios? Because as you lower your sodium, the volume of fluid does go down. And also there's various symptoms with low sodium, like muscle weakness, like fatigue, like increased cortisol. And unfortunately, the potassium only comes in a 99 milligram tablet. Our bodies need 4,700 milligrams of potassium every single day. Because one of the things that potassium does is it helps soften the arteries. And so if we're talking about insulin, and then we look one step before that, now we're talking about the triggers. What triggers insulin to go up? Right here. Refined sugar, that would be starch, which then is going to cause you to retain sodium. This is why even like a pre-diabetic or a diabetic holds a lot of fluid in the lower feet and ankles. Another trigger, and we're talking about the root causes right here, is chronic stress. Stress also causes the constriction of the arteries, and stress also activates your blood pressure. Let's also talk about low magnesium. This can also trigger high blood pressure. Magnesium is the key mineral to unlock the calcium in the smooth muscle around the artery, helping you lower your blood pressure. And so just think about one of the top medications for blood pressure. It's called a calcium channel blocker. Well, magnesium is a natural calcium channel blocker. So it allows the calcium to come out of the artery and relax the muscle, reducing the pressure. If you're deficient in magnesium, typically people will have muscle tightness. They'll definitely have leg cramps that wake them up in the middle of the night, or the foot that cramps, tight muscles up here. And of course, refined sugar and stress deplete magnesium. They also deplete potassium. The next huge driver of hypertension is sleep apnea. And so sleep apnea really disrupts your sleep, which then will affect your blood pressure. People that don't sleep well because they're not breathing well place a huge stress on the cardiovascular system. Inflammation is another root cause of hypertension. That can be coming from eating a lot of junk food, not getting sleep. Smoking creates inflammation in the arteries. Also, we have low sun. So you're inside all the time. You don't get sun exposure. The sun actually gives some really cool benefits to the arteries. One is nitric oxide, and also another one is infrared, and another one is vitamin D. And if you're sitting under a fluorescent light all day, that is going to affect your blood pressure. We've already talked about the sodium-potassium ratio. Very, very important in keeping your blood pressure normalized. A sedentary lifestyle alone can increase your blood pressure. Our bodies were designed to move, and the exercise piece to help someone lower their blood pressure is very significant. We're going to talk about that. And of course, obesity is another factor in blood pressure. So a lot of people ask me, what supplements do I recommend? Now, of course, I'm not biased of my own high quality supplement line, but if you go to Amazon and type Dr. Berg supplements, you'll find more information. Now, the big question is to be able to look at non-drug things that a person can do to lower the blood pressure. The DASH diet. What is the DASH diet? Well, it's definitely the reduction of junk food, increasing fruits and vegetables. Of course, they did whole grains, which I don't recommend. They also recommend poultry, fish, not much red meat, low saturated fat, overall low fat. Anyway, I'm just going to let you know that the DASH diet and reducing sodium can drop your blood pressure by 11.5 points. There's a lot of other diets that they haven't done any research on, and just because they haven't done the research on it doesn't mean that other diets might not help you. I'm just pointing out, if you look into the research, this is what it says, the DASH diet. Now, typical hypertension medication can reduce your blood pressure between 8 and 12 points, possibly a little bit more than this diet, but it comes with a package. It's called a polypharmacy. You have a lot of different medications, a lot of people are on, and you don't really know what is causing what. But that's why I'm doing this video, to show you other things that you could potentially work with your doctor on to possibly come off the medication slowly with the help of your doctor and add some of these other things in there. My disclaimer here is don't come off your medication without the help of your doctor, because you may be at a point up here where there's organ damage and it's irreversible. You're not going to be able to reverse that blood pressure problem, unfortunately, because it's too far down in this chain of events, in which case you might need to be on medication. But my viewpoint is, why not try to bring it down here, and also encourage your friends and family to do something about this blood pressure earlier so they don't have to end up maybe where you are right now. A CPAP machine, if you have sleep apnea, can reduce the blood pressure by 5 to 10 points. That just shows you how important sleep is for your blood pressure. Look at exercise right here. 4 to 9 point reduction in your blood pressure. That's why consistent exercise is vital. Check this out. Garlic can reduce your blood pressure just as much as exercise. Wow. Then we get potassium. Having enough potassium, consuming avocados, having some salad can reduce your blood pressure by 4 to 8 points. Lowering sodium can bring it down by 2 to 8 points. There are a lot of problems in our bodies when we start going too low with sodium. Muscle problems, fatigue, and sleeping problems. So my thought is, be careful when you start reducing the sodium too much. Look at this. Hibiscus tea can bring your blood pressure down by 5 to 7 points. Now, the DASH-only diet without lowering your sodium, okay, brings it down roughly about 5.5 points. The breathing, like I mentioned before, which is absolutely free, 3 to 5 point drop in blood pressure, and magnesium, 3 to 5 point drop. Now, I mean, a therapeutic dosage would go to 600, 800, 900 milligrams of magnesium glycinate. That way you get the best absorption, and magnesium maybe at that therapeutic dosage can be even higher than that. And of course, sunlight only brings it down a few points, but every little bit helps. And I think the big question that people ask is, can hypertension be reversed? In some cases it can, but unfortunately, a lot of people are not given the alternatives to medication. Well, that's what we're talking about in this video. But there's one last thing. I don't think they've done a lot of research on it, but it creates a huge drop in inflammation, refined sugars, and improvement in your vascular system, and that is intermittent fasting. So a lot of people ask me, what supplements do I recommend? Now, of course, I'm not biased of my own high-quality supplement line, but if you go to Amazon and type Dr. Berg supplements, you'll find more information.